Some common symptoms of TMJ or temporomandibular disorder are pain and tenderness when eating, yawning, or moving your jaw, causing in some cases headaches, toothaches, or earaches. It can also cause joint dysfunction and limited range of motion. Hi, does your jaw click, pop, hurt, lock, open, or shut? Then you need to watch this video. I made it for you. Hi, my name is Dr. David Kulla of Synergy Wellness, Chiropractic and Physical Therapy in New York City. Today we discuss everything about the jaw. Temporomandibular disorders are a group of disorders that all involve the temporomandibular joint, which is found just in front of the ear between the temporal bone and the mandible or jawbone. There are also associated muscles of chewing and speech in that area. Normally between the temporal bone and the jawbone, there's a synovial cavity wrapped in fibrocartilage and filled with synovial fluid, which is a protein-rich fluid that reduces friction between the sliding bones. And there's also an upper and a lower compartment divided by a disc in the middle. The muscles surrounding the joint are called the temporalis muscle up here, the masseter muscle, and both the lateral and medial pterygoids. Those muscles are all innervated or controlled by the trigeminal nerve. Now, the causes of temporomandibular joint disorders can be categorized in two ways. One, intra-articular within the joint, or two, extra-articular, outside the joint, involving the surrounding musculature. Intra-articular causes are called TMJ disorders and involve abnormalities of the bone in the joint, or inflammation like osteoarthritis or rheumatoid arthritis. Disorders of the disc or laxity of the fibrocartilage, or even trauma or bleeding in the joint. Extra-articular causes are TMJ or temporomandibular muscle disorders. They include overuse of the muscles like bruxism, which is grinding or clenching of your teeth, or muscle inflammation. Some common symptoms of TMJ or temporomandibular disorder are pain and tenderness when eating, yawning, or moving your jaw, causing in some cases headaches, toothaches, or earaches. It can also cause joint dysfunction and limited range of motion, where the jaw locks or cannot open completely or close. Clicking or popping noise in the jaw is also very common, as well as jaw deviations. It's important to get a proper diagnosis. The internal jaw can be looked at further by plain X-ray film or CT scan if needed, or if intra-articular damage is suspected. MRIs can tell us more about inflammation of the intra-articular disc and evidence of joint inflammation. Treatment of TMJ disorders depends on the underlying cause. Either way, the initial goal is to help reduce pain and inflammation and improve jaw function. Some helpful therapies are massage of the masseter muscles in here and temporal muscles, and also the pterygoid muscles, moist heat or a cold compress, softer food diet, avoid strain like dental work or chewy foods, oral appliances for nocturnal bruxism, cognitive behavioral therapy to get to the cause of the grinding, medications like muscle relaxers and NSAIDs, physical therapy. I made a really great video with several great TMJ exercises and stretches. Make sure you check that one out. Chiropractic adjustment for proper jaw alignment and muscle function. Some cases require surgery or arthroscopy. And last but definitely not least is cold laser therapy. It can be extremely helpful, not only for pain and inflammation, but for both intra and extra-articular temporomandibular joint disorders. If you have any questions about TMJ, the jaw, or anything related, don't hesitate to comment below. Hope you like this video and it was informative. Don't forget to subscribe and keep tubing in. Thanks.